Hi there, John Farahmand from Balanced Physical Therapy coming at you today with some fun facts about ACL injuries, okay? Typically, when we think about an ACL injury, we think about athletics. We think about athletes. We think about the football players, the basketball players, and the soccer players that sustain these injuries while they're competing or practicing. Those three sports, in order, are the highest incidence and prevalence of ACL injury typically. Football, basketball, followed by soccer, okay? Female athletes are more likely to experience an ACL injury than male athletes. And this has to do a little bit with the anatomical arrangement of things. Ladies typically have a wider pelvis than men, and it creates a larger angulation distally as you follow the femur down, which puts them at a little bit more a risk of having an ACL injury. That coupled with some other factors that we'll leave for another time. 50% of ACL injuries, and this part is kind of unfortunate, can be and typically are associated with other ligamentous and or cartilage damage within the knee. So having an isolated ACL injury without any damage whatsoever to any other structures in the knee only happens about 50% of the time. The other 50% are accompanied by other damage. Maybe it's the MCL, the medial collateral ligament. Maybe it's the medial meniscus. Maybe it's even the articular cartilage if it's an impact type of an injury. In general, again, surgery is typically recommended. We used to call surgery a repair, an ACL repair, years and years ago when I started as a therapist. Repairs are very rarely done. Now it's a complete reconstruction. So ACL reconstruction is typically recommended. However, I'm not a competitive athlete anymore. I'm a middle-aged man with children, and I don't have to compete at a high level athletically. So if I tore my ACL, I may be able to do without surgery, just depending on the extent of the damage in my knee. So for a younger competitive athlete who wants to stay in competitive athletics, typically a reconstruction is going to be recommended, but not always, okay? There are caveats to each individual case. The next point I want to talk about is that everybody associates ACL injury with these massive collisions, in general. Oh my gosh, I got my knee hyperextended, or somebody fell on me from the outside. And what I want to talk to you about is that 70% of ACL injuries that happen on the athletic field happen as a result of non-contact injury. Let me say that one more time. 70% of all ACL injuries that happen out on the athletic field occur without contact. How is this possible? You're thinking, wait a second, I thought I had to get hit to tear my ACL. No, you don't. Think about this, running full speed straight ahead, planting and stopping and changing direction very, very rapidly. Sometimes the rotational force of your femur, the large bone in your thigh, spinning on a fixed tibia below it is enough torsional force to completely tear or rupture the ACL. And that's something that most athletes don't think about, and that's why they're not so worried about having or sustaining an ACL injury. But it is very common, and it is largely, not completely, but largely preventable with good, solid, programmed exercise, strength training, conditioning, balance training, jump training, sprint training, multi-directional training in a controlled environment. We can't always prevent an ACL injury, but we can certainly do things to help exposure to risk. And that is what preventative strength training and conditioning is all about, is mitigating possible risks and decreasing your exposure to risk by preparing your body for as many of the potential loads that are going to be placed on it during athletic competition. There's not a clinic on the planet that I know of that can replicate, a whole bunch of, 250 plus pound linemen piling on top of a running back. It's just impossible to do in a clinical setting, but we can strength train, we can condition, we can work on mobility, stretching, jump training, sprint training, etc. so that running back, for example, has the strongest, fittest, most flexible body that person could possibly have to minimize the risk for a potential ACL injury on the athletic field. So if you're not doing any preventative strength training whatsoever and you are a competitive athlete at all in field sports, as a physical therapist and as someone who deeply cares about your health and your wellness and your longevity, I would highly encourage you, off-season, in-season, year-round, to train and to condition your body to minimize your exposure to potential risk. Because remember, you do not have to have a contact with another athlete to rupture your ACL. You could literally be in the open field all by yourself and rupture your ACL. So please do your part as an athlete to minimize your risk. Get some help, get an evaluation, get on a good, solid strengthening and conditioning program, and minimize your risk to have this devastating injury, please. Thanks very much for listening. If you found any value in this, you found that it resonated with you, or you think that you know someone who could find some value in this video, please like it, please share it, and send your comments. We'd appreciate your feedback. Visit us at balancept.com or on Instagram at balanceptmove. Thank you.